Choosing the wrong Medicare plan can cost you. The good news is you can fix it. In this episode, you'll hear from Thad Ismart, Senior Financial Planner, about how to choose the right plan for you and the key differences between your main options, plus a common gap that you might not consider when it comes to travel, and why coverages look the same, but prices are different.
I would start at the Medicare.gov and think about what you need. Do you need a lot of prescriptions? Are you healthy? Are you not healthy? And it's really just comparing cost. It might be a lot of work, but compare cost. You know what A is, the cost is, it's free. B, you know what B is, you know what that's going to be. So then all you need to do is compare, find a plan, Advantage plan, Part C plan that has everything you need. If you want a high deductible, low deductible, whatever the cost is, whatever the plan is, find that, add up all the costs, and then compare the benefits that you have in that plan to the same prescriptions in a Part D plan and similar out-of-pocket costs, the help with out-of-pocket costs from a Medigap policy. Compare the premiums for the Advantage plan and then the Medigap and the Part D plan. And assuming that they have the same or similar benefits, compare the premiums. What are you paying?
And as a reminder for people who might not be as familiar with all the different letters and everything else, if you're doing Medicare Original, you would have which parts? And let's break them down.
That would be Part A, which is your ambulance rides, emergency room visits. That's free. Part B, which is your doctor visits, preventative care, diagnostic testing, physicals, those types of things. Part D is a prescription drug plan.
And that's something you can shop around for.
You will shop around for that at private health insurance companies. It's state-based. And the Medigap policies. The Medigap policies are going to help cover out-of-pocket costs. Part C, that is your Medicare Advantage plan. That's the one-stop shop approach for your Medicare needs.
And that would be like you're not doing all the other letters, you're just doing C then.
Correct. And think of that as similar to the health insurance that you had through your employer. And it can be a PPO, an HMO, or a paid-for-fee service. Lots of different plans. And it also can include health, vision, dental, where the original Medicare, which is A, B, and then Part D and Medigap, typically do not have those. So if you don't have the Medicare Advantage plan, you're probably going to need a private supplemental plan that can include health, vision, hearing, if that's something you need.
And that's where you'd go for the Medigap.
Correct. Medicare Advantage could also have health insurance coverage outside of the United States, but the original Medicare does not.
So when you're saying outside of the United States, let's say that you decide to be an expat, some other country, then you would still have